Hello, my name is Niar Fleming, and I'm doing a presentation on schizophrenia. Schizophrenia, an exploration of chronic psychodynamic conditions. The father of schizophrenia, Dr. Paul Eugene Buehler devised the phrase schizophrenia in 1908 from the theory of dementia praecox by psychiatrist Emil Kraepelin. Buehler adjusted the term due to the notion of the splitting of the personality rather than dementia. Specifically, he defines schizophrenia as a conglomerate of disorders that coexist that make it difficult for the mentally ill to function with the outside world from the inability to connect with themselves in an organized and progressive way. Buehler was a psychiatrist that specialized in autism and schizophrenia during the early 1900s. The modern concept defined in psychology. Modern psychology doesn't support Buehler's concept of splitting of the individual's psyche. Schizophrenia is defined today as a critical psychological disorder that significantly disturbs an individual's emotions, concepts, and behaviors. It impairs an individual from progressive behavior and thought process through psychosis that causes delusions. Schizophrenia is largely known for its hallucinations. Um, People with schizophrenia tend to cope by seeking emotional support from relationships to distract from unpleasant psychotic occurrences, and it is a deteriorating mental disorder. The interrelated links of the disorder. The causes of schizophrenia are linked to a combination of genetic and environmental factors. Um, Another cause of schizophrenia are neurotransmitters, brain anatomy, events during pregnancy. Those events are related to extreme amount of stress that the mother can have, and marijuana use. Marijuana can cause a person to experience hallucinations, and uh, over time that could develop into schizophrenic-like tendencies. Textbook DSM-5 criterion for schizophrenia, where two or more of the following each present for a significant portion of time during a 1 month period or less if significantly treated, at least on them should include 1, 2, or 3. um, According to a student's guide to important changes in DSM-5, a supplement for Barlow and Duran and Barlow's abnormal psychology textbooks, criterion A, characteristic symptoms, delusions, hallucinations, disorganized speech, frequent derailment or incoherence, grossly disorganized or catatonic behavior, negative symptoms, diminished emotional expression, abolition. Criterion B, social occupational dysfunction. For a significant portion of the time since the onset of disturbance, one or more major areas of functioning, such as school, work, interpersonal relationships, or self-care, are markedly low. The level markedly below the level achieved prior to the onset or when the onset is in a child or adolescence. Failure to achieve expected level of interpersonal, academic, or occupational achievement. Criterion C, duration. Continuous signs of the disturbance persist for at least 6 months. This 6-month period must include at least a 1 month of symptoms or less if successfully treated that meet criterion A, i.e., active phase symptoms, and may include periods of prodromal or residual symptoms. During these prodromal or residual periods, the signs of the disturbance may be manifested by only negative symptoms or by an attenuated form of 2 or more symptoms listed in criterion A, e.g., odd beliefs, unusual perceptual experiences. Criterion D, schizoaffective and mood disorder exclusion. Schizoaffective disorder and depressive or bipolar disorder with psychotic features have been ruled out because either one, no major depressive or manic episodes have occurred concurrently with the active phase symptoms, or two, if mood episodes have occurred during active phase symptoms, they have been present for a minority of the total duration of the active and residual periods of the illness. Criterion E, substance medical condition exclusion. The disturbance is not attributable to the psychological effects of a substance, e.g., a drug of abuse, a medication, or another medical condition. Criterion F, relationship to a pervasive developmental disorder. If there is a history of autism spectrum disorder or communication disorder of childhood onset, the additional diagnosis of schizophrenia is made only if prominent delusions or hallucinations, in addition to the other required symptoms of schizophrenia, are also present for at least 1 month, if successfully treated. The symptoms of schizophrenia include hallucinations, delusions, paranoid delusions, grandiose delusions, somatic delusions, disorganized thinking, catatonic behaviors, diminished emotional expression, avolition, alogia, and anhedonia. Excuse me. Methodological approaches to the thought process. Treatment options include CBT, cognitive behavioral therapy, ACT, assertive community treatment, CSC, coordinated specialty care, and MCT, metacognitive therapy. Modern research on metacognitive therapy. Research shows that tailored metacognition treatment decreases symptoms and builds social standing. It also reduces psychotic behaviors. Metacognition, reflection, and insight therapy is a form of MCT designed for schizophrenia. They help individuals become aware of their thoughts with methods that help to dissipate worrying and non-progressive thoughts. Moreover, clients become more aware of their thought process as they examine their thoughts from a more conscious mind frame than an indoctrinative one. So in the example, it says trigger first negative thought. I imagine a intrusive experience. Here we go again. What if people see me talking to the voice? Which leads to positive beliefs about worrying or rumination. Worrying helps me cope. Worrying helps me remembering things. Type 1 worry about specific experience or belief. People will think I'm mad, I'll be attacked. Negative beliefs about worry or rumination. Worrying is uncontrollable. I need to control my worrying thoughts or something bad will happen. Type 2 worrying about worry. I'll be losing control if I go crazy. Behavior avoidance, reassurance, hypervigilance, thought control, suppression, distraction, analyze evidence for and against emotion, anxiety symptoms, heart racing, tension, hearing voices. But that basically just shows like how being conscious about the way you think and breaking it down can help you with dealing with it and help you create a more better and healthier thought process. Adverse health impacts. Schizophrenia can reduce 10 years of life. Research indicates that schizophrenic individuals are more susceptible to obesity-related health issues than people without psychological disorders. Schizophrenics are at an increased risk of cardiovascular diseases linked to diabetic conditions and obesity. It's fairly common for people with schizophrenia to stop taking their medication or to not take their medication continuously, which significantly impacts the treatment process. So that point specifically just talks about how like if they stop their medication, it can lead to them maybe self-medicating through food or substance abuse, which is the next point. Substance abuse is a common coping mechanism for people with schizophrenia that could inadvertently cause medical problems. Okay, so according to the National Institute of Mental Health, The frequency of psychotic-related disorders range between 0.25% and 0.64% in the US, relatively low in commonality amongst other prominent psychological disorders. As you can see in the picture on the right, it is fairly low compared to major depressive um, disorder, anxiety disorders, and co-occurring mental health and addiction disorders. Almost half of people with schizophrenia have coexisting mental health disorders, and over 1 million people affected by, there are over 1 million people affected by mental health, according to the National Alliance on Mental Health. So, assessment of schizophrenic spectrum. Schizoaffective disorder is similar to, oh, actually, excuse me. Assessment of schizophrenic spectrum. The schizophrenic spectrum is a scale of certifiable disorders due to its continuous or episodic symptoms, and the subtypes are subject to change over time. Specific to a patient's psyche, spectrums help classify conditions of a patient. Schizoaffective disorder is similar to schizophrenia with major mood episodes, schizo- schizophreniform disorder, and schizotypal um, personality disorder. Modern research on schizophrenia. Today's research observes the benefits of living arrangements that cater to someone with schizophrenia that improves their social relationship, and research indicates it does. It also observes the isolation or loneliness that people with schizophrenia experience amongst their peers. Um, they're most likely to experience significant feelings of loneliness, as seen on the graph. Most of the time that schizophrenic spend is alone, compared to time with coworker, friends, family. Uh, I mean, compared to times with family, friend, health workers, spouse, and strangers. Okay. The public perception of schizophrenia. May 24th is Worldwide Schizophrenia Day, raises awareness for more than 21 million people worldwide who have schizophrenia. Reducing the stigma against mental health can help people. Uh, in my personal life, my grandma has schizophrenia. So things like schizophrenia day can help uh, everyday people uh, understand the mental illness and can help reduce the stigmas against it and help people like my grandma reduce maybe the loneliness and the coping mechanisms that they develop from being kind of ostracized in by their peers in society. Um, Also, psychotic mental disorders are incredibly popular on entertainment platforms. So the infamous movie Psycho by Alfred Hitchcock, um, other movies that have killers like what's the movie? The Shining, uh, where they basically kind of romanticize psychotic killers, especially in our media today, kind of showcase uh, this is how we basically in society kind of look at psychotic disorders, schizophrenic disorders, um, without really actually knowing what it is. So yeah, and that's it. So thank you so much. Bye.